We're told that a healthy lifestyle is really important in type 2 diabetes. And there are a lot of reasons for that, but a lot of the time we don't understand, and it's just advice that we're getting from our doctor. But there are many reasons why lifestyle is critical. It's the antidote to inflammation. And inflammation is what causes all the complications of the chronic diseases that we're seeing, including those that we see in type 2 diabetes, which are heart attacks and strokes, kidney disease, eye disease, and nerve disease, and many other things as well. So how we live our life, the style in which we live our life, makes a big difference in terms of whether or not we're going to have inflammation and the tendency for insulin resistance to develop. We have the choice. We can either work with real prevention by living a healthy lifestyle. We can try to look for early detection, which means the disease has already started, or we can try to treat the disease. The choice is up to us. Drugs are not an ideal solution for type 2 diabetes. All of them have complications, and some of them are outright dangerous and yet still on the market and approved by the FDA. There's a drug that's been used for a while called metformin, which is probably the safest of the drugs which is out there. It increases insulin sensitivity and tends to bring blood sugar levels down into normal. But did you know that we have problems 52% of the time with diarrhea and 25% of the time with nausea and or vomiting? That we have gas in 12%, and we have weakness in 9%, and indigestion in 7%, and headaches in 6%. Add those up. A lot of people are having side effects from what is probably the most commonly accepted drug to be used for type 2 diabetes. The other family of drugs that seemed like they might be quite effective were the glitazones. That included Rezulin, Avandia, and a drug made in Japan called Actos. Now, the drug that was first out, Rezulin, because it was increasing insulin sensitivity, was thought to be a panacea. But as it turned out, it was taken off the market by the FDA because it caused way too many cases of liver failure, deaths, and liver transplant. The second drug, Avandia, is now in disrepute and probably going to be removed from the market in this country and has been removed already in Great Britain. And that's because it increases your risk for a heart attack by 50% at least, and your risk of dying from it by 50% more than those people who are not on the drug. The last drug, Actos, is no great panacea either, because it probably has some of the same side effects, which are pretty serious, as those drugs. So what we need to do is be thinking about ways to make our lifestyle as healthy as we can. If we eat right and we exercise regularly, and we remove our exposure to toxic chemicals, and we take care of any low-grade infections like periodontal problems, we keep our weight right, get adequate sleep, reduce our stress, and have a meaningful purpose in our life, we'll be doing what we can to prevent type 2 diabetes, not early detection, and certainly not having to cure the disease.